So I want to go back to the issue about the changing demographics in a way, but I want to focus on the intersection of race, ethnicity, region, age, and health, because these all are coming together in significant sort of ways. Ron will be the first person to say that demography is not destiny, and I'll agree with that too as well.
Don't be insulted.
I put those words in his mouth. I mean, you wouldn't say that, I think. But the fact is that what's happening in terms of the change in society is not being felt smoothly across the kinds of groups and divisions that I talked about before. And that's going to become a very important issue as we move into this older society. For example, the proportion of blacks in the United States has decreased, but it really hasn't decreased evenly. And those declines have been felt more in northern and western states than they have in southern states where it's high. While the Hispanic, Latino population is now the largest single racial and ethnic minority group in the United States, although not a homogeneous group by any stretch of the imagination, but a heterogeneous group in many ways. And we see, again, that what's happening with regard to different states, different metropolitan regions, and other areas is going to be very important for both those groups. In fact, we are now talking about majority-minority states that already exist. There are 4 states for which the total population is already majority-minority. I love that kind of term. There's something wrong with it, but majority-minority. Hawaii, New Mexico, California, and Texas. If we look at the below 18 year of age, and I'm going to come back to why that's important in just a moment, there are 10 states for which that's already true right now as of 2010. And there are 12 states if we look at that being true with regard to pre-kindergarten. So the issue, and if we look within certain kinds of metro areas in terms of this size, we can already see that the differences in terms of this issue about an older non-Hispanic white population and a younger minority population is true in places like Los Angeles and New York, Chicago, Dallas, Atlanta, and the number is actually growing. So this whole notion with regard to this pyramid is very different for different groups, and is very different as we look at various different states and units. So while ethnic and racial minorities have not enjoyed the benefits of the longevity kind of revolution that's taking place in the United States, they have enjoyed some of those. And minority elders today are about 16% of those who are over 65. And I want to hasten to add one thing here that we have a tendency to forget, that if we're looking out to 2050, that those people who are going to be 65 in 2050 are alive right now. They are among us, they're living, they're having certain kinds of experiences, and those experiences are going to impact in terms of what their 65 post years look like. And sometimes we have this notion that people arrive at age 65, whole cloth, with no background, no experience, they just somehow there and they're 65. And that's not true at all. And it has very important implications. So those 5-year-old Latino children right now who are born and having the experiences, their experiences right now are going to be very important as we look at them post 65. But between now and around 2050, African American elders over 65 will increase 128%. Asian American elders are going to increase 301%. Hispanic American elders are going to increase 322%. And American Indian and Alaska Natives will increase 193%. And these are all groups that are disadvantaged on major health indices and health care indices. And these are the people who are going to be making up that older population. The future, though, in this is both a more heterogeneous, that is racially, ethnically, older population, but also, in some ways, a more homogeneous, younger population. And I know that's strange, because the older population will be mixed somewhat. So by 2050, 54% of the population overall will be ethnic and racial minority. That's what some of the projections are saying. Those under 18 will be 62% of the population. Those who are 18 to 64, 65, but 42% of the older population. So you kind of got this interesting mix of younger people who are going to be ethnic and racial minorities. Some people have talked about the potential for a cultural gap with regard to race and age. For example, the percent of non-Hispanic white minus the percent of non-Hispanic white below the age of 18. And we see this potential cultural gaps for many states, Arizona, Nevada, New Mexico, and so on, where you have younger populations that are largely ethnic and racial minority. The implications of this, of course, are what happens with regard to the needs of the population of ethnic and racial minorities. And in fact, we already have some sign of that if we look at what's happening with regard to aid for education, the willingness of communities to tax themselves largely to provide educational opportunities for young ethnic and racial minority populations. It really hasn't been pretty. But we also have the other issue too as well. What will this young ethnic and racial minority populations, in some areas numbering 80% of the populations, think about supporting older non-Hispanic whites, particularly given the kind of low-wage jobs that have been available to these groups and the kind of low-wage jobs indeed that might be in the future, and also with regard to what we talked about before, with probably lowered kinds of health care and so on. Now, I think these things can be fixed. But we really have to think about them, and we really have to begin to engage policies that will not let these kinds of cultural wars come to fruition as we do become the aging society. Thank you.
Thank you, James. James, are there experiences in some of these states that are kind of the leading edge of the demographic change with respect to the racial mix that so far have worked out well or badly, that could be informative one way or another?
Well, that's an interesting question. I think some people in some states, I mentioned California, New Mexico, Texas, other places and so on. Well, again, you don't want to be a harbinger of bad news coming, but I mentioned the issue with regard to the willingness of providing resources for education.
Right.
And so far what we've seen is that an older non-Hispanic white population has been somewhat hesitant to provide educational resources for largely ethnic and racial minority younger people. I mean, I think that's evident.
It's not a good prognostic sign.
No, it's not.
Thank you.
All right.
Louisa?